Hey everyone, my name is Logan Sept and I'm a third year medical student at the University of Alberta. And I'm here today with Alanna Supersad virtually, who is a PGY3 radiology resident at the University of Alberta. Dr. Supersad has graciously agreed to answer some of my questions about radiology and that I think that medical students across the country could benefit from hearing. This video is part of a series of videos produced by the Medical Student Network as part of the Canadian Association of Radiologists. In these videos, medical students across Canada are just interviewing various radiologists from different backgrounds and different fields in order to learn a little bit more about the field of radiology. So without further ado, Dr. Supersad, tell me a little bit about you and your journey to radiology.
Awesome. So as mentioned, I'm Alanna. I'm a PGY3 here in Edmonton at the University of Alberta. A little bit about me. I'm born and raised in Edmonton. I have lived for a little bit in Spain, a little bit in Victoria, and went to Calgary for a few years for medical school and then matched back to Edmonton. So it's good to be back in my home city where I'm familiar. I ended up picking radiology. I guess I'll tell you a little bit about my story. So I used to work in the radiology department at one of the hospitals in Edmonton during my undergrad years, just part-time. So I was quite familiar with it. At the time, I didn't think I ever wanted to do medicine. When I got into medicine, I was like, there's no way I'm doing radiology. It's like not really my thing. But then when it came time to pick electives, I ended up picking what I was familiar with, which was radiology and emerge. And then I did a few radiology electives, actually only 2. And as I kind of went through clerkship, I liked radiology more and more. I ended up hating emerge. So that kind of counted that out. And in the end, I didn't really find another specialty that had sort of the characteristics that I felt that radiology did, that I valued for what I envisioned my future career to be. So some of the things about radiology that I love. It's a very versatile career as a subspecialty. I think that it's something that has a lot of breadth and depth. And in terms of decision making, I feel like I was going to be able to, pick radiology as a residency, and then you still have a lot of choice thereafter in how you want to tailor your career. In terms of fellowship and subspecialization, community work, hospital work, academic career, etc. And so that was something that I really valued. One of the other things about radiology is communication, and you're constantly acting as a consultant to other subspecialties. So you spend a lot of time chatting to other people and working as a team. That's something that I quite like. And you're working with the technologists and the nursing staff, and you're always talking to your colleagues, of course, as residents, but I saw it a lot in staff where, hey, what do you think about this case? Or, hey, check out this interesting case. And that's something that I quite liked and thought would be fun as a career in the future. So in the end, I picked radiology because I thought I would enjoy the challenge and the complexity of something that remained dynamic and versatile, and that allowed for a lot of communication and working as part of a sort of interdisciplinary team. And here I am. Luckily, I matched to Edmonton and radiology in my home city. So
awesome. So is there any specific field of radiology that you're interested in right now?
Yeah, so as a PGY3, that's kind of my deadline for picking what I want to do in terms of applying to fellowship within the next year. My top pick right now, I think, would be body radiology. So probably abdomen, pelvis type of imaging. I think it's, again, something that's quite broad and versatile in terms of including procedures. It also has a good amount of non-procedural work if one so chooses. You can do some sort of pelvic imaging and female imaging as well, which is something that I think I would be interested in. And other things that I like, I like just about everything. So interventional radiology, I guess, would be on the list. Pediatrics is probably somewhere on the list. Again, it's, there's so many things that go on in peds that are quite interesting. And chest radiology is also quite interesting. But again, that's still quite a long list. Other specialties that aren't really my thing are MSK and neuro, both very interesting, just not really my cup of tea.
So it sounds like there's a lot of options for subspecialization then.
Yeah, totally. Yeah. And lots of people don't do fellowship too and are general radiologists, which is also super awesome because, again, it's, still very challenging, still very interesting work on a broad scale. So that's another option. I do think that I will like to subspecialize, but body is probably top of my list right now.
Cool. So you're a PGY3 right now. What's the typical day like in the life of a radiology resident?
Yeah, so this varies institution to institution. So I'll speak mainly to here at the U of A. So every single morning we have academic teaching rounds. So from 7:30 to 8:30, we have Zoom rounds currently. In pre-COVID times, these used to be in person at the university hospital and then video casted over to the other hospitals. But for now, all of our residents attend via Zoom and they're taught by different staff. And then after those rounds finish from 8:30 to about noon, we do sort of our morning rotation. So for example, right now I'm on my ultrasound rotation. So I'll be checking ultrasounds, reporting the cases, doing a little bit of scanning. And then we have a bit of a lunch break, at which time we either review our cases with staff if there's stuff left to review, and take a little bit of a break, maybe get a coffee, or we often have academic teaching rounds over the lunch hour. So things like grand rounds, interdisciplinary trauma rounds with the trauma surgeons and the emergency physicians. Luckily, again, it's sort of all over Zoom. I know everyone has a bit of a different opinion on that, but it's been great to just collaborate and have it available to everyone. And then in the afternoon, again, we go back to our rotations and wrap up around 4:35 in the evening. If we're on call, then it's about 5 o'clock until 11 p.m. We take an evening call. Some people work a night shift. We have a bit of a different call system here in Edmonton where we do like a full week of nights. We have a night float system, so we don't do 24 hours of call. So in terms of a typical day, your normal day goes about like 7:30 to 5. If you're on call, then it goes until about 11. And if you're on night shift, obviously you're not working during the daytime, so that's a whole different schedule. And then if we have dedicated academic half day, which is on Wednesdays for us, we spend the afternoon in didactic type sessions from 1 o'clock until 5 o'clock, taught by different radiologists. So it's a lot of work. It's quite challenging. We spend a lot of time after hours, after 5 p.m. studying, being involved in different committee work, et cetera. But it's definitely rewarding and it's fun. And we switch our rotations every 4 weeks, which is nice. You know, it's 1 week you're on ultrasound, and then after 4 weeks you move on and you're on nuclear medicine, and then after that maybe MSK or MRI. So it's quite engaging, and as I said, it's quite challenging, but very fun, and I think it keeps us all on our toes.
Cool. That night float system, how huge is that for you?
I love it. It's only been implemented here for 2 years, but that's been my whole time in call. So I think I value not working for a full 24-hour shift. Some people prefer 24-hour shifts, but at the end of the day, I think there's quite a bit of literature and research about, the shorter shifts and having a night float type system. And so I quite like it. When you're on a 7 stretch of nights, the first night's a little rough.
Yeah.
Second night's not too bad. It depends how easy you're switching over, but by night 3 or 4, it's just how it is. You're more awake, you're more alert, opposed to, being on hour 20, trying to read a trauma scan, you're on hour 4, even though it's 4 in the morning. I quite like it. I like shift work though. I'm someone who quite enjoys different shifts. So it's really not too bad. And I think our cohort as a whole likes it. So
cool.
Stick around.
So for the people who are thinking maybe radiology is for me, what types of people make good radiologists in your opinion? And what are people's personalities like in radiology?
Yeah, so as I mentioned earlier, there's a lot of communication and a lot of teamwork in radiology. So definitely people who enjoy being able to talk things out and collaborate with other people. So if you have the type of personality that you love to collaborate, and you enjoy that communication, and you're sort of adaptable and open-minded, I think that's very important in radiology because contrary to popular belief, it's not all black and white. There's a lot of in between. There's a lot of, unfortunately, like some sort of subjectivity just by basis of the complexity of a lot of the patients. So you have to be willing to adapt to what's going on with a certain patient, perhaps a specific situation, and be able to read a complex case in a challenging situation and perhaps ask one of your colleagues for help or ask for their opinion. So I think someone who's adaptable and open-minded and, a good communicator and willing to collaborate and wanting to work hard. I think radiology where, you're always studying, you're always learning. things are always going to be changing from the technology standpoint moving forward, and especially in our lifetime. I think it's important to be someone who wants to keep up with the times and knows how to and is willing to be able to put in that work. So all in all, be able to work hard, communicate, collaborate, and have fun while you're doing it. Like anything, I think that goes for every specialty in medicine. You gotta be able to have fun while you're going through the grind.
Are there any stereotypes about radiologists that you think are false and you want to disprove?
Yeah, I think people think, we sit in our room and read x-rays. We don't really want to see patients. We don't really want to talk to people, which I find quite the opposite. You're never sitting there writing a long patient note with your mouth closed for a long time. You're either talking into a dictaphone or you're talking on the phone with somebody, or there's people coming into your office, whether it's a technologist or you're collaborating directly with the nursing staff on a procedure. So I think people often think we, are quiet people who don't want to talk, when in fact it's quite the opposite, that we spend pretty much our entire day speaking. And actually a large portion of that is collaborating with other specialists. We're often on the phone with the surgical team looking for a specific study, or emerge, or trauma, literally anybody. And they call you for your opinion or to ask for a study. And similar with working with the technologists, I think, people quite like to talk in radiology and like to have fun again while we're doing it. I'm probably just speaking for Edmonton, but everyone is having a good time. I think people are happy to be there. And we probably don't all love the dark as much as people think we do. We have quite a few people in our program who like to get outside, and they're quite active and like to do fun stuff. So we just keep the dark for work hours and still enjoy it. But
Cool.
yeah.
Cool. You had mentioned earlier that radiologists do some procedures, and you can kind of vary the amount of procedures you do depending on what you choose. So what are some of the procedures that you do?
Yeah, so through radiology residency, you get exposure to essentially everything, which is kind of nice to see what you like and what you don't like, or if you hate procedures, you're like, okay, cool, I'm kind of done with it. But we do all sorts of biopsies. So ultrasound guided biopsies, like for example, a liver biopsy or a kidney biopsy. We could be doing it under CT if it's a little bit more complex. So again, biopsies under ultrasound or CT, all types of tubes and drains. If someone has an abscess, again, using ultrasound or perhaps CT to kind of find it, get in there and poke a drain in it. We do lots of fluoro guided procedures, so joint injections, again, placement of lines and tubes. We do a lot of that on surgical patients, a lot of that in pediatrics as well. So again, I'll just speak to the depth and breadth of all the different types of procedures, whether you're in a community center and you're doing joint injections all day. A lot of people quite like that, or you're in the hospital and you're working with either pediatrics, which is a complex population, and yet very interesting, or with adults and post-surgical type things. It's quite variable, but there's a ton of procedures that are involved. And that's only a few that I've named. To be honest, I probably couldn't get through even the half of them.
Yeah.
But there's options and lots of hands-on, tons of hands-on. Yeah.
Well, yeah, I think that kind of goes against one of the stereotypes that I hear. It's, you're just on the computer all day, but it sounds like there is an opportunity to really work with your hands in radiology.
Oh, totally.
Yeah. What's the job market like in Canada? Is it easy or hard to find a job?
Yeah, so I would say it's pretty good. Like the one thing about radiology, it's very different city to city and specifically province to province. So for example, here in Edmonton, there's some groups that work in the hospital and some that don't. And there's options. Like it's not, I don't want to say it's easy to get a job, because you definitely have to be a good radiologist coming out of residency and again, be willing to work hard, but there's definitely options. So things to make yourself marketable. If you're going to go through a Canadian residency training program for radiology, you're going to come out well trained, as long as you made it through and you hit your, all your markers. Essentially you'll be qualified after the Royal College and hopefully do well, because all of the programs across the country are excellent. And then in terms of if you're getting involved or you're just willing to work hard and get yourself out there, there are jobs. It's a matter of how flexible you're willing to be. If you want to work, you only want to do neurointerventional and you only want to do it in one city, unfortunately, sometimes there might not be that one specific job. However, depending what you want to do, if you're flexible, if you're willing to move or willing to work in a different position, or maybe pick up more call or more night shifts, and that's what a group is looking for, then there are jobs for sure.
Awesome. So last question, do you have any general advice for med students who are interested in matching to radiology?
Yeah, that's a tough one. It's the best. It's honestly the best career. So just go for it. If it's something that you're interested in, I would say try your best to get in and chat to residents as much as possible. Even staff, if you can be around them, ask them, what do they like about their job? What do they like about the residency? What do they wish they'd done differently, if anything? One thing that I quite liked to hear as I was decision making through clerkship is I'd meet other subspecialists on my rotations, and if they knew I liked radiology, they'd say, oh yeah, that's awesome. Like, I kind of wish I did that. And I never really met other people who'd say, oh, that's dumb. Like, why do you want to do radiology? Or I'd never met a radiologist who said, oh yeah, I wish I wasn't a radiologist. Like, I really wish I was something else. So it is important to try and talk to people as much as possible. Ask them what they like, ask them, if they want to change anything, or if they have any specific advice as well. Get involved with things if you have the time. Medical school is crazy busy, so it's so easy to say and much harder to do. If you are a research person, try and get involved in some research. It's a great way to get to know faculty at a specific program. This interview is put on by the Medical Student Network, by the CAR. So that's another place that students can get involved, and just to kind of get a foot in the door and hear what's going on and hear how other people are liking it or what other people are doing. I think that's always a good thing to do. And if you're in it and you're like not really liking it, or you're on your electives, and you're like, I don't really think I want to sit down all day. I don't think I want to talk on the phone. I don't really want to do that. Then maybe try and do some more shadowing to double check that you don't like it. Because keeping in mind radiology electives are rough. Like, they're hard. It's hard compared to other electives. It's hard to be involved in a radiology elective. So it's not always representative of what you're doing. So the best thing to do if you're thinking of applying is, keep up the electives, keep up the shadowing, try and get involved and get to know people, and chat with them. Zoom has really given us a platform to fire off an email to anyone across the country and say, can I meet with you? Most residents, I think, would be open to that. So if you like a program, or if you meet somebody on some sort of virtual session, just feel free to fire off an email to anybody, and just try and chat with them about specifically their residency and their thoughts on radiology as a career, and see if it fits with what you think and what you like.
Yeah, wow. Thanks so much for all that great information and for taking time out of your busy schedule to answer some of my questions. I hope the viewers were able to learn something today about the field of radiology and get a little bit of insight into what it's like to be a resident in radiology. And yeah, thanks again, Dr. Supersad. We'll say bye.
See you.